Good afternoon, and thank you for joining us here today. I'm the Alberta NDP Official Opposition Critic for Children's Services, and I'm joined today by Health Critic David Shepherd. I want to acknowledge that we are gathered here on the traditional territory of the signatories of Treaty 6, as well as to recognize the Métis people who share a deep connection to this land. We come forward today on behalf of Alberta parents and children who are very worried. We're calling for tangible and real action at all levels of government to acquire children's pain medication and fever medication and to work collaboratively to restock pharmacy shelves. Our opposition caucus has been inundated with reports and cries for help from Albertans whose kids have gotten sick and who have been unable to find necessary pain medication. There has been a major spike in cases of influenza, RSV, the common cold, and COVID-19 among children. We know that the major metro public school boards have reported tens of thousands of students being absent due to illness. This prompted our colleague and NDP Deputy Leader and Education Critic Sarah Hoffman to write to the UCP Education and Health Ministers yesterday, demanding that they develop an emergency public health plan to further prevent the spread of illness and to keep schools open for in-person learning. Public reporting indicates that 4 in 13 Albertans who have ended up in intensive care with one of these illnesses have been children younger than the age of 9. In some instances, families have not needed a hospital but feel helpless, and with no other choice after being unable to find medicine at their local pharmacy, they're going to emergency rooms. As such, emergency rooms wait times at the Alberta Children's Hospital in Calgary have shot up to 17 hours at a time, and those at the Stollery here in Edmonton have exceeded 16 hours. Like thousands of Alberta families, my kids were homesick last week. And when my son spiked a fever, on top of our worry about his symptoms and his comfort, we were also incredibly anxious because we only have one bottle of children's Advil at home, and we're lucky. Every time we pass a pharmacy or grocery store, we look for more children's pain medications, but the shelves are empty. As a parent, it is heartbreaking to not be able to relieve your child's pain and discomfort. Any parent who has been up all night with a child who is in pain and who has a fever knows that all you want to do is to make them feel better, to bring them some relief so that they can rest and get better. The helplessness and anguish of not being able to do that is absolutely unbearable as a parent. And right now, no parent wants to take their child to the hospital for fear of them being exposed to other illnesses and because we're all aware of those long, long wait times. Our hospitals and frontline healthcare workers cannot cope with more patients simply because parents do not have what they need to manage their children's symptoms at home. Like many parents, I have a constant knot of anxiety in the pit of my stomach about my kids needing medical support and that they won't be there for them when they need it. And now I worry that I also don't have the tools that I need to keep them safe at home. This is unacceptable. It is not what any parent or child should be facing in our province. It's why David and I have written a joint letter to the provincial and federal health ministers, Ministers Copping and Duclos, calling for better collaboration on procuring emergency shipments of children's medicine. We're also calling specifically on the UCP government to provide daily reporting to the people of Alberta on the pain medicines that are received. And we also need to hear clear timelines on when the UCP expects to have proper access to these items at their local pharmacies, not just in hospitals. And this must continue until inventories of pain medications normalize. We're also calling on Alberta Health Services itself to launch an emergency initiative to directly procure children's pain medication or the materials needed to compound those pain medications at local pharmacies. And for more on that, I will now turn to my colleague David Shepherd.
Well, thank you, Rakhi. And I do want to first extend my sympathies to many families who have gone through so much stress and anxiety in recent days. Over the weekend, Danielle Smith told those listening to her weekend radio show that she's talked with the Alberta Pharmacists Association about the challenges they're facing. But we need more than that. We need real action. We've seen no emergency directives from Health Minister Copping or from Premier Smith to Alberta Health Services to procure its own supply of medicine. Over the weekend, our NDP official opposition consulted privately on potential solutions with health officials. They confirmed that now that Health Canada has suspended the requirements for bilingual labels, AHS should be able to use its purchasing power to procure an increased and reasonable supply for infant and children's Tylenol and Advil, amoxicillin, and generic substitutes. This is an extraordinary step, but this is a desperate time. AHS used similar purchasing power to gather its own PPE at the height of the COVID-19 waves. We've confirmed that AHS already buys some of these materials for the wholesale market. We need to know to what extent they're doing this on an emergency basis now. And as Rakhi said, we need public reporting of those measures. And both elected and public health officials should be made available to answer questions from parents. And there's more, too. Dr. Danielle Pays, Chief Pharmacist Officer for the Canadian Pharmacists Association, has called for everyone to help reduce the demand for drugs like amoxicillin by staying up to date with their routine immunizations and COVID-19 boosters, and by following good hand hygiene. And of course, we all have the option to choose to wear a mask in public spaces. This is something Danielle Smith just won't do. Last week, I called on her to publicly declare that COVID-19 vaccines have saved countless lives and to reject the views of Paul Alexander, who she has invited to consult on Alberta healthcare. Now, remember, Dr. Paul Alexander really has no place in our public health discussion here, having called the COVID-19 vaccine a bioweapon. And I also demanded that Danielle Smith rescind his invitation to provide input. My message to the entire UCP government is that it's long past time to put the health of our children at risk over political games. And it's with that in mind that I come to our last call. And that's for an emergency action plan to properly staff the Alberta Children's Hospital and the Stollery, and to work to reduce wait times at both hospitals. 17 hours is simply nowhere near acceptable. These are children. They are sick. They deserve access to health care. Their parents should be able to acquire the medicine they need to reduce their pain, and they should rest assured that there's capacity at their local hospital should things take a turn for the worse. So thank you, and both of us would be happy to take any questions.
Thank you, and we'll start with questions in person, and we'll go to questions on the phone. Just a reminder to press *9 if you're joining us on the phone, raise hand function if you're joining us via Zoom. If you could say your name and your outlet at the top. Go to our first caller.
EP, can you hear me?
Go ahead, Dean.
Okay, David, it's not clear to me, maybe it's clear to you, who's in charge of public health with this government? I mean, we've got Hinshaw, but she's nowhere to be found. She reports to Copping, but the Premier's also said that she's making the decisions based on a team of advisors. Is it clear to you who's in charge here?
Well, thanks for the question, Dean, and sadly, no. Albertans are left somewhat bereft of knowing who is actually making these decisions about public health care in Alberta. As you said, the Premier has said she has a team of advisors. We've called for her to disclose who they are, and then they suddenly said, well, we're not quite sure, it's not quite ready yet. She's invited someone like Dr. Paul Alexander, who called the COVID-19 vaccine a bioweapon. Apparently, he's invited to come and consult. Has he? Is he having any influence on our system? We don't know. So really, we need to get a clear picture from the Premier, from our Minister of Health, who is steering the ship. And they should be coming to a microphone today to speak to Alberta families, to tell them what they intend to do to meet this current crisis, this current challenge. And indeed, one of the other things we've called for as a caucus is an independent science table, much like they have in Ontario, that provides politics-free advice rooted in science and fact for the government to make decisions on crucial areas of public health. Here in Alberta, we simply don't know who's in charge, and Albertans deserve to find out.
Thanks. Yeah, as a follow-up, how would you assess how they've communicated in the last few days about this crisis in schools and in children's hospitals?
Perhaps I'll let Rakhi take that as a parent herself.
Thanks, David, and thanks, Dean, for the question. You know, As I mentioned, I'm a parent who's coping with sick kids. My other child has spiked a fever today, and it's, once again, like thousands of other parents and children across the province right now, we are all struggling to find some information. When you ask what do we make of the communications or what's been communicated over the last couple of days, there really hasn't been anything communicated to Alberta parents about whether or not they're going to ever get access to pain meds for their kids, what's going on to make sure that our children's hospitals don't collapse the way they are in Ontario right now. And we're seeing those wait times have been astronomical at children's hospitals for the last few weeks, if not a few months. These are all problems that have been coming for some time, and we've heard no public statements from either the Premier or the Minister of Health coming forward, speaking directly to Alberta parents, telling them what action they're taking. Ultimately, healthcare is a provincial responsibility. We know there have been challenges around pain medication related to labeling and packaging, which we are now hearing that Health Canada is addressing. But this has been a growing problem for months. We've seen the spike in respiratory illnesses in this province since midsummer, late summer. And there's been no comfort, no direction, no timelines provided to Alberta parents, indicating to them that the provincial government is in control and is handling this critical public health situation. It's been pretty much silence. We haven't heard anything other than the Minister of Education simply saying that this situation happens, this just happens. That brings no comfort to parents to not only deal with the absences that their kids are facing now, but we may not have seen the worst of this. In fact, there's a lot of reason to believe that things are only going to get worse in the weeks to come. So parents need to know that there is somebody steering the ship, that there is clear action being taken to make sure that those medications are available to children and families from their local pharmacies, that they don't have to go to busy, overrun hospitals in order to get comfort and relief for their pain and fever symptoms.
We'll go to our next caller. Not hearing David, so we'll go to our next caller.
Hi, Rakhi. It's Michelle Bellefontaine. David, it's Michelle Bellefontaine from CBC. I just want to follow up a little bit on what Dean just asked. I guess what I'm looking at is just the information about outbreaks in schools. It appears that the government is not providing that information, and I'm wondering, what effect that would have on parents. Yeah, that's the question.
Well, thanks, Michelle. So, I mean, as a parent of kids in elementary school, and my children's elementary school was actually listed as one of the top 10 with outbreaks in Edmonton Public last week. Not surprising, as we're seeing, I know firsthand from the other parents that many students are not in school right now. What I can tell you is that we only know this because, of course, the schools are reporting their absences, but there is no information coming either to the school boards or to parents at large about what the status is of where those outbreaks are, what the conditions are. All we know is what's being reported to schools that kids are not attending. What that also means is we don't know what actions are being taken to mitigate that and to address that. Again, silence from the key ministers, and we're waiting to hear if there is a plan or they're just going to let this happen. We, as a parent, this is not acceptable. We also know that kids are getting sick and they're not getting better completely before they get sick again. I'm probably in my household going to be looking at a second week of school absences after the November break ends tomorrow. So that'll be possibly 2 weeks of absences for my students or for my kids, and that's not unique. So where is the plan? What is the who's in charge and who's actually gathering information and taking action? As a parent, I am completely at sea, and I think many other parents are as well, waiting to see if this province is going to take this responsibility seriously.
Can you follow up, Michelle?
Yeah, just as a follow-up, in terms of the school boards themselves, I mean, should they be the ones taking action? I know that with Edmonton Public, the board chair, Tricia Estabrooks, has said that, we're not the ones that should be making public health decisions. That should be the province and AHS. So, but in the absence of this, I mean, should, say, a school board like Edmonton Public take measures on its own and take its chances with the provincial government?
Well, listen, I think school boards are in no different of a position than, politicians are. We are not doctors. We are not public health experts. It's why we have been very clear as an opposition caucus to say we needed that independent science table so that those actors in the system, like school boards, like the government, could have some independent information to make decisions upon. Right now, the lack of, direction and clarity as to who is making decisions, if decisions are even being made, who's doing the research, who is gathering the information. With that lack of information, it puts at a disadvantage even school boards to know what action to take. What we're asking, what school boards need, is for the provincial government to step up and act like the provincial government, to act like the government responsible for healthcare, which they are. They need to stand up, speak to parents, speak to school boards, tell us what information they're relying upon, find out which experts are advising on that, and so that we can all have some trust in the decisions that are being made. Right now, no decisions are being made, no information is forthcoming, and school boards and parents are at a complete loss as to what to do.
And that's all for today. Thank you very much.
Much for watching, and to learn more, check out albertasfuture.ca.